لا إله إلا الله لا إله إلا الله لا إله إلا الله ما لنا رب سواه.
Assalamu alaikum, everyone. We're on the clock. It's a pleasure to have you all here, and for those joining us right now, my name is Vassis Selka. I'm one of the co-founders of AMSA, and it's my pleasure. And honestly, everyone here has been excited for quite some time to invite Fatima Fahs with us today on the Zoom.
I'm really happy to be here. Thank you for having me, you guys. This will be so fun. I feel like super lucky to kick off this program for you guys. And so hopefully tonight we can just make this really beneficial, answer any questions you have, tell you a little bit about myself, and hopefully you walk away feeling inspired and also ready to get some more work done as a med student and take your next step that you've been waiting on. So happy to be here.
Inshallah, the pleasure is all ours. And just a little bit about Dr. Fahs. She is a Michigan native, graduated with honors from Wayne State University with a Bachelor of Science in Biology and a minor in art. She then earned her medical degree from Oakland University of Beaumont School of Medicine. She practices medical, cosmetic, and surgical dermatology. She has a distinct interest in skincare and product formulation, researching the effectiveness of over-the-counter cosmetics. A lot of you might know her, but she runs a very highly successful Instagram account, Dermadoctor, that has gained popularity. I think almost 70,000 followers at this point, mashallah, for its engaging and effective approach to common dermatological questions and concerns. So without further ado, we'll just open the floor. The night is going to be structured kind of in two parts. First, we're going to have some general questions for Dr. Fahs and have her answer, as long answers or as short answers as she likes. And then from there, we'll open up the floor to everyone here and see if there's any questions from the crowd. So first, Dr. Fahs, tell us about yourself. What made you go to med school? Why dermatology? Why are you here with us right now?
So I have to say this kind of does feel like a residency interview question. I just got a little PTSD flashback because I honestly cringed when I got that question every residency interview. And maybe this is a good thing to note for you guys when you're ready for interview time. You're going to get that question over and over again. Tell me about yourself. So you should get really good at talking about yourself in a succinct, concise way to summarize your life in like 2 minutes. So I'm going to try to do that. I'm going to take myself back to residency interviews. But like you said, I'm a Michigander, born and raised. Lived in Michigan all my life, probably never leaving here. So that part of me is a little boring. But I currently reside here in West Bloomfield, Michigan. I'm a dermatologist. So that means I went to medical school for 4 years. Then I went to residency for 4 years. In dermatology, you have 1 year internship, 3 years of dermatology residency. And I graduated after that. You can choose to do fellowships after, which I'm happy to talk to anybody about if you have questions on that. But I decided to remain a general dermatologist. So that means I practice medical, surgical, and cosmetic dermatology. So everything from rashes to acne to skin cancers to surgeries and some pimple popper stuff, and also some cosmetic fun things in between. I currently work 4 days a week, which is considered full-time in dermatology. I have 2 kids and a husband, and that's a little bit about me. So happy to answer additional questions. Oh, I think you muted yourself, Bassett.
Oh, yeah, hey, I'm a rookie. So I guess you kind of introduced a lot of different hats you're wearing right now. Mother, wife, obviously doctor, Muslim woman. How have these identities kind of shaped your journey?
Yeah, absolutely. So I definitely think that it can be a really tough process to find balance between all those things, especially on your medical journey. I definitely feel like at times in med school, residency, I found myself really trying to figure out all of those hats and how to wear them. But to me, what I've come to realize over time is I can do all of those things. I'm just not going to always do all of those things really well every day. So we were just talking before we let everybody in today. Today was a really rough work day. I had a really intense, long work day, long drive home. I was tired. I came home, sat in my garage for 10 minutes because when you become a parent, you have second shift after work or after residency or whatever. You walk in and it's round 2 and then it's with kids. But to me, part of my journey has also been picking a really supportive, amazing partner that is understanding of my schedule and also can pick up where I leave off. So today I was a really good doctor and like a pretty not so great mom, but that's okay because I had a long day and it was a little rough and I'll be a better mom tomorrow. So I didn't do dinner. My husband did. I was a little slower with the kids in terms of activities. He is currently putting our son to bed, so I can be here to do this. So one of the biggest points I wanted to get across today is I always felt in med school like I had to figure everything out. And I was always like, well, how am I going to do this and also do that? And like, well, this is really important to me too, but I also want a career. And it's possible to do all those things. You just have to also get to the point where you accept that you're never going to do all of those things amazingly at once. And it may look like that to other people, but on your day-to-day, something has to give. And that's always been a little difficult for me to like personally accept. It's something I still work on. But I think it's important to come across, especially for those of you who are wondering what life outside of medicine is going to be like. And the most successful physicians are those who also find joy outside of their career. It's very important to be passionate about your career, but it's also very easy to feel burnt out by it. The day in, the day out, insurances, patients, angry people, difficult cases, deaths, there's a lot. So if you can't find happiness outside of that, it can make the day-to-day very difficult to get through.
And I'm that conflict you're talking about all these things, you know, that you feel like you have to do perfectly at once. I know a lot of the med students here feel that on a daily basis. So it's great hearing about that. Specifically, even though you're, you know, carrying all these hats and doing all this work, you still somehow found the time to start Dermadoctor. Could you tell us a little bit about how that started and how you found the time to not just, you know, create it, but do an incredible job with it?
Yeah, so I will say one thing about Instagram and social media that I've come to learn is it will not be fulfilling for you. It will fulfill other people to come to your page, to learn from you, to see funny things. But you will find if you decide to go this route that it also carries a lot of responsibility and also like a lot of stress. So for me, I started Dermadoctor in my first year of dermatology residency. So I was a PGY2, meaning I had already finished my intern year. I was starting my dermatology training. And I just did it as like a outlet for expression. I wanted to get creative with something. And that's kind of the same idea I had in undergrad when I pursued an art minor. I wanted something outside of medicine that I enjoyed, and art has always been something I've gravitated towards. So in residency, this was like a creative outlet for me, taking fun pictures. And when Instagram back in, what was that, 2017 was like pretty basic, like a few filters, fun stuff. You could do like some fun flat lays. And I found a lot of joy in doing that and educating people. And then it's kind of just catapulted into something larger. You'll notice on my Instagram, I don't follow any algorithm. I don't make myself post every day. I don't take every opportunity to jump on a trend. And that's because I've come to understand that I need to maintain my life outside of Instagram. So Instagram's a lot of fun and you can meet a lot of cool people and there can be a lot of cool opportunities that come from it. But I've also realized that it can be a big time suck. It can be very stressful and feel very demanding because people feel entitled to your time, your answers, your DMs, etc. So I've slowly but surely started to put some barriers for myself when it comes to Instagram. That being said, as medical students or, you know, future physicians, if you're interested in doing something like this, I do think it's a really cool space to educate people. However, day in and day out, I see a ton of things that worry me about our medical field as a whole. So a few reminders for you, especially if this is something you're considering. Number one, you worked way too hard to get into med school and become a doctor to compromise your credibility on social media. So there will be plenty of opportunities for you to accept paid advertisements, endorse a product, put your name behind something because you're a doctor, and it's going to feel really cool and special to you. Like, wow, this company really wants me. But it's also very easy to get taken advantage of and also compromise your credibility in front of your patients. So to me, social media is fun and lighthearted and a great way to educate. And yes, sometimes I do take paid promotions, but I'm very selective about those opportunities because at the end of the day, I never want my word or my ethics as a physician to be questioned. And as long as you continue to remind yourself that this is a side thing, you are a physician first, you worked way too hard to get to that point, you won't lose sight of that. But it is really easy to get entrapped in the excitement and the trend of Instagram and lose sight of maintaining your oath as a physician and also your credibility. So that's kind of my like old mama bear warning for you guys if you're thinking about that process.
Jazakallah khair. And in this chat right now, we have, inshallah, many aspiring Muslim physicians that will be in the public eye. And mashallah, you've been in the public eye for, some time, doing a great job. Is there anything as a Muslim that shaped that experience or that you learned from it, or advice that you'd give anyone here?
Yes, I would definitely say that daily your patience with others will be tested. Whether it's a very rude comment, somebody saying something nasty in my DMs, somebody once accidentally sent me my post and was talking about me, meant to send it to a friend, and I ended up seeing it. There's going to be lots of ways that your confidence is tested, that your faith in others and humanity is tested, and that you're going to be tested on if you can hold your tongue. And I've learned that it's much easier to be graceful and short and polite and move on, because no, keyboard warriors are worth your time and effort, and they will happen no matter what, what kind of Instagram or social media you choose to have. I think the saying that cool kids say is haters gonna hate. So you just got to roll with it and let it go and move on, because as long as you remind yourself, this is not reality and this is not the most important thing to me. I have a family, a career, my kids, other things that I'm passionate about, then you will not lose sight of that.
Absolutely, inshallah. And as a Muslim filling in a certain space within like the medical and social community, we're wondering, are there any other opportunities you think for aspiring Muslim leaders outside in social media and beyond that you think that there's a great opportunity, we should put our sights on that?
Yes, I think getting involved in organizations like this is a great first step, because you're going to learn leadership and you're going to learn how to communicate and you're going to learn how to rally and group together, and then taking those skills and also going to national organizations within your specialty. As a medical student, for me, as a medical student, I slowly worked my way up in the leadership of the American Medical Women's Association. And there wasn't really anybody that looked like me. And then eventually I was voted and became the national student president of the entire American Medical Women's Association, which was really huge because it allowed me to see people's vote of confidence in myself for who I was, and not the way I looked necessarily, but for my leadership skills. So I think that there's a lot of opportunities for Muslim physicians or physicians to integrate themselves in other organizations as well, because you have a voice and you can make a change and people will listen, especially if you're somebody to be respected and you can show up and deliver good work. So that's important.
Absolutely. And you said something interesting. You said not a lot of people that look like me. And that's something we hear a lot, in Muslim spaces. So could you tell us about, how you had the confidence and strength to kind of be authentic, stand to your own ethics and values in places where you might have been seen as the other?
Yeah, I mean, I think that's like something that all of us, whether you wear hijab or not, maybe it's more so your values or what you're willing to do or not do. It's going to come up in medical situations, but I've thought a lot. I would be lying if I didn't admit that I've had struggles with my hijab so much, especially in the dermatology space. It's very important to have a certain aesthetic or look, and not a lot of people in dermatology look like me, but there are now a handful, which I love to see. And I think it's important that we continue to represent that space. But remaining authentic to myself has always been a top priority for me, even when I didn't have my own self-confidence. And I would just constantly remind myself of opportunities or ways where I had interactions with people or patients, for example, that did have an outlook change or a change of heart or a better understanding of maybe a stereotype they made, that I was able to dispel for them. So that's something that constantly goes through my head, because I think it's really easy to want to blend in and look like everybody else. And sometimes there's power in sticking out like a sore thumb. So I'll give you one example. When I was applying as an applicant to dermatology, one of my friends from the American Medical Women's Association was at a dermatology residency already. And I had texted her and said, hey, could you talk to your program director and have them take a look at my application? I'd love to come interview at your program. And so she did. She went to her program director. They said, sure, let me pull up this girl's application. Pulled it up, scrolling through. Oh, this looks great. Got to the end, and there was my picture in my hijab. And verbatim, she told me that program director slowly turned around, looked at her and said, I think she won't fit in here. And that hurt. It hurt that my friend told me that, but I know she was telling me it out of a loving place. As a non-Muslim white woman, she never really had realized that that was a thing. But on the flip side of that, now that I am in this space, I'm very easily recognized. And at conferences, I do stick out like a sore thumb, and I don't mind it because people see me and they know exactly who I am. And that feels really good and validating, because I've earned my space to be there and to be known. And I'm proud of that. But there was a long period of time where I questioned if I should make a change or remove my hijab or be like everybody else, because I thought that would make my process of matching easier. And I know that, had I gone back and done that, I probably would have gotten more interviews, but would that have made me happier in the long run, not being authentic to my true self? I don't think so.
Jazakallah khair for an incredible story. We're gonna transition a little bit to kind of talk about dermatology in general. I know we have a lot of aspiring dermatologists here. Can you tell us something that you think all med students should know about dermatology, regardless of what specialty they pursue?
Yeah, absolutely. I do. That's my son crying. Sorry. I do think that it's important to know that dermatology is not just maybe what you see on Instagram. So it's not just skincare. In fact, actually, that's a very, very small part of it. Dermatology is very sophisticated. There's actually over 3,000 dermatological conditions. There's really rare, crazy stuff that none of your other friends in medical school will ever have heard of, and you're going to learn and drill into your head in dermatology residency. Lots of people think dermatology residency is like a cush or easy residency. So I will say that although the hours may not be intense, the outside part of clinical time is what's intense. So for me, it was a lot of independent studying. Our textbooks in dermatology, these two large Bologna textbooks, are both this thick, and you get through the whole thing and learn the craziest terms for rashes and conditions and certain lesions, and you feel like you kind of have to learn a whole new language. So the most intense part of it for me was teaching myself or having self-discipline to do a lot of independent study. that's probably what makes dermatology hard. And that's what makes it competitive too, because you have to be very willing to be self-disciplined and find time to study those things so that you pass your boards. The other big thing that I always get is, do you have to practice all aspects of dermatology? And you don't. So I have friends who just do general dermatology, meaning rashes, skin checks, etc. I have some friends who do complex medical dermatology, so really rare diseases that present on the skin. You can do an additional fellowship for 1 year after dermatology in pediatric dermatology. Although all dermatologists, including myself, see pediatric patients, pediatric dermatologists take an extra 1 year fellowship to study all the extremely rare diseases that are seen in childhood patients, and will sometimes refer to them at academic centers for very rare findings. You can also do a surgical subspecialty. So there's something called Mohs surgery, MOHS, which is a specialized form of skin cancer surgery on the face that requires an additional 1 year of training. So if you're very surgically oriented, you love putting things back together, finding amazing ways to create beautiful flaps or bring skin back together after skin cancer reconstruction, that's another option. And then you can even do dermatopathology, which is basically pathology of dermatology. So maybe some of you are crazy about histology. I was not, but you do have to learn histology and dermatology residency. Once a week, we sat at the microscope, we read through all our biopsy slides. You have to learn a ton of histology and dermatology residency, and you can go on and do an additional 1 year fellowship in that. This is the case with actually most specialties. So I will say that as a med student, I thought I understood specialties. And if you have a little inkling or curiosity about something, dive a little deeper, go try to shadow somebody who does it, just to see like what else is out there. Because oftentimes as a third year, fourth year med student, you do this quick rotation and you think you understand the breadth of that specialty, but there's so many subspecialties within it. So you can absolutely like niche down into something very specific that you're passionate about, pretty much in any specialty, including dermatology. So that's what I'd want you guys to know.
Exactly. And if someone here were to want to apply to dermatology residency, everyone knows it's very highly competitive. What is some advice that you'd give them?
So I did not decide on dermatology applications until my third year. And I went to Oakland University and I was the second graduating class. So nobody above me had applied to dermatology and nobody in my class was applying. So you can imagine the admins were like, Fatima, are you sure you want to apply to this? And I was like, yes, I do. And they're like, we're kind of a new school. Nobody really knows who we are yet. We've had nobody match into this. Like, it's your third year. You don't really have a lot going on yet. And I was like, no, I'm going to apply. And they're like, well, do you want to do a backup? And I was like, no, this is what I want. So you can imagine it was a big relief from the entire school when I matched, because they really didn't want to ruin their match rate. And I was on the line to ruin it. But I did not decide right away. So you don't have to be a first year and be like, yes, I'm dermatology, this is what I'm doing. You can decide later on, and that includes other specialties too. I will say, if you want to go for a more competitive specialty, your first 2 years should be dedicated to getting good grades, so that when you get to your step one, you are ready to go. One of the top things I did that really helped me is I unbound and spiraled my step one review book. So after every single organ system, I would go back through after the exam and annotate the crap out of that section, put in practice questions that I'd done, write in extra things that came up on tests, so that by the time I got to board studying, I had already been through that step one booklet. You guys still use step one, right? I'm not that old. Okay. Yes?
Yeah, but step one's pass fail now.
I know. Yes, that's true. So the next thing that has come up now is what's going to happen after that. So step two is now becoming more important. Either way, you want to be sharp academically. And then the research, which everybody freaks out about, will come. And I tell people, you don't have to figure out research in your first 2 years of med school. As a third year, rotating in the hospital, you will 1000% have the opportunity to find people who need help with research. And one of the best ways to do that is on your rotations when you're with residents. Residents are stressed out. They have research deadlines they have to meet, and they would love an eager, organized med student. What you don't want to do is say, hey, do you have research that I can do? And then not know what to do. Instead, you want to find out if they're working on something and say, hey, I think I can help you finish this by X, Y, and Z. Would that be okay? And I could put my name on it with you. Yeah, that sounds like a great idea. Why don't you do this and send me your draft when you're done? So be a helpful med student, and you will easily get research opportunities in your third and fourth year. But it's really hard to cold email people and just ask about research, because most people aren't like always working on something that they have an extra person available for. And don't feel like you have to have that figured out. I think with dermatology or any kind of more competitive specialty, it can be really daunting to see some of these people who report like 30 publications and, like 1 million presentations. And that's truly not the case for everybody. And it was not the case for me. But what I did show was a lot of passion. I did my away rotations and I was a very hands-on med student, but I did not get in people's way. So I was not annoying. I tried to be friendly to the residents. I showed up early or on time. I made myself useful, and I would like to think, a joy to be around as a med student. So those are the things that the residents are looking at when you're rotating with them. They just want somebody to help them make their life easier. They don't want a know-it-all. So I think that a lot of times we lose sight of the personality factor when it comes to matching into a specialty, especially if you have the chance to do an away rotation. So don't feel discouraged if your application isn't this like all-star application, because you can shine in other ways.
That's amazing advice. And right now, before we open up the floor to questions from the crowd, is there any last remaining, like, you guys need to know this advice that you'd like to give everyone here?
Yes. I think probably the most helpful advice that I wish somebody like would drill to me over and over again was, you don't have to have it all figured out. And in fact, if you think you have it all figured out, you don't, because you're going to change your mind, and that's okay. You're going to be met with some unexpected obstacle that you weren't ready to handle, and that's okay. You're going to fail at something, and that's okay. As a med student, you are so used to being a high achiever and getting everything right. And that's just not life, right? Like, life is not going to work that way for you all the time. Something's got to give, and that's okay. You use it as a learning opportunity, you regroup, you figure out your next step, and you move forward. But learning those skills as a medical student is going to make you a better resident, a more flexible attending, and better in your outside life outside of medicine, which we said was super important. So I know that it can feel like your entire life is hinging on if you are going to be an X type of doctor, but there's so much more outside of that. And I don't want you to lose sight of that or forget that you've already made it this far. So you are more than capable. So what is meant for you and what is written for you is going to happen. And if it's not the way you envisioned it, it doesn't mean it's not going to all work out, because a lot of times we cannot see the future ahead. We only are in that moment. And it's so hard to wrap our brains around how we're going to move past that difficult point. And you are capable of doing that, and there will be something better after it. But part of this process, unfortunately, or fortunately, I guess if you can look at it positively, is the struggle. And that's okay, because in the end, and I know you hear this from attendings all the time, but it really is going to be okay. And like, life at the end of the tunnel does feel a lot better, and there will be new stresses that you encounter, right? It's not like all your stress goes away after residency. I have new stress that I carry, but I've learned to just kind of roll with things a little better now. So hopefully you can do that too.
Jazakallah khair. So now we'll open up questions to the audience. If you have a question, just send a like whatever X or a question in the chat, and we'll just call on you to ask your question. And if you don't want to be recorded and have your voice recorded, you can just send your question itself in the chat.
I love the awkward silence.
Oh man, it's great.
I have a question, if you guys don't mind. Oh, sorry, I forgot to use the system.
Okay.
All right.
Go ahead.
So you obviously, first of all, thank you so much for taking the time to be here. You obviously worked very hard with your loose leaf papers that you would work on and write on. Obviously, it's hard to get into med school. Obviously, it's hard to get into residency. Getting through residency, you had those big textbooks. It's a very busy time you had in training, and then afterwards, not only do you work, but you have social media and things on the side and a family. Big discussion that a lot of us have around this time, and I'm sure you can relate or remember, was kind of when do we take the foot off the gas, so to speak? And even if it's not like an all or nothing thing, when do we ease up? Because we're so often in this kind of go mindset.
Yeah.
Did you ever have those same thoughts when you were in any year of medical school? And how did you process that then? How do you feel about it now? And would you change anything if you could go back?
That's a great question. So one of the things I've always struggled with is making time for myself that doesn't involve doing something productive. Like as a very type A person, my husband will tell you I am a Nazi when it comes to schedules, appointments, putting things on a calendar. Like I'm psychotic about it. And it's very bad. It's a type A in me that I just want to have everything planned. And one of the things I realized along the way, actually early, because I decided to pursue an art minor, is you have to schedule joy in your day. So for me in undergrad, my joy from being a stressed out pre-med was my 3-hour studio art classes, where I would literally be among these awesome hippie art majors. And it was me, the art minor pre-med girl. And we would just paint for 3 hours in silence. And it was like I really miss that. It was the most amazing feeling, because I would leave Orgo stressed out and like freaking out about the next steps. And I would have to force myself to just shut it off for 3 hours. In medical school, that became a different, outlet for me. And during medical school, that was like working out and running. I really got into that. And like, I scheduled time to make time for that. In residency, that became a little harder, but that's where my passion for social media started. And I actually found, as I was telling you guys, really a lot of enjoyment in getting creative with sharing information on social media. Before, like, it took forever to make a reel and all this extra stuff that we have to do now. It was just a lot of fun to get creative with photos and like fun filters and flat lays and like really cool educational content. And so that was my outlet. Now I do things a little differently. So 2 things. One, as a mom, there's not a lot of great free time, but one thing I always joke about on my social media is literally I have an hour of like trash TV by myself at night. That is my guilty pleasure. That makes me feel so good to turn my brain off and to literally watch women yelling at each other on Bravo. And it just feels right. Tomorrow I have my admin day. So Wednesdays are my day where I'm not at work, and that's where I'm supposed to play catch up, but I also run my box business. During tomorrow's intense admin day, I think I was counting like 15 meetings, but I have a scheduled massage for myself at 3 p.m. I scheduled it. You have to schedule joy. If you don't schedule it or make it a habit or make time for yourself, you will just be slamming on that gas pedal and you will burn out very, very quickly. And so many of my friends have. And sometimes I don't do this right? Like, it's not like I always have this figured out. Sometimes I need my husband to literally shake me and be like, you need to schedule time for yourself. And it can be small little pockets of peace or moments where you just turn things off. But it's so helpful because it really helps you fill your cup back up or fill your gas tank back up and get back on the road. But if you don't do it, you very quickly will realize how soon you'll run on E and you'll be done. So I hope that kind of reminds you to do that for yourself, because it can feel like you just have this giant to-do list and doing something for yourself is selfish, but you have to remember that if you don't take care of yourself right now in this stage of your training, it's going to become very easy to forget that in the longer hours of residency, or the ability to not say no as an attending. And that can be really, really difficult to break that habit.
So I think someone mentioned having a question in the chat.
That was me. Assalamualaikum. Thank you so much for speaking with us today. Can you talk to us a little about what it's like to be a businesswoman? You created Dermadoctor, and so I'm just curious to learn more about how that came to be and what it's like doing that.
Yeah. So honestly, in med school, we learn nothing about business, finance, managing your money, getting creative, having outside passions. And for me, a lot of what I've learned has just been on the whim, I'll be honest. Like, I've always kind of had an interest in business, but I don't know the first thing about it. So honestly, Dermadoctor was just born from the idea that I just kept getting DMs from people asking me for product recommendations and questions about specific things. And I was like, man, instead of just sharing stuff on my story, I really wish I could just like hand people the stuff I'm loving for that season. And my husband was like, well, why can't you? And I was like, what do you mean? And he's like, well, you could do that. And I was like, really? You think I could do a subscription box? And he's like, yeah. I was like, but I don't know anything about it. And he's like, so we can learn. And literally that's what we did. I watched YouTube videos. I read a ton of blogs about starting your own subscription box. I went to a subscription box conference last year. As a medical student, you are a high grade learner. You are good at learning. You've taught yourself to maximize your time and absorb information. So even though it's not your niche, it's not your specialty, it's not what you're used to, I guarantee you anything you're interested in doing business-wise, you're smarter than a lot of people to sit down and figure out how to do it. And we've done a lot of like stupid things along the way, mistakes I've made, financial decisions for the business that have been fails, but it's been a really cool process to learn and continue to grow from that. So I will say the one thing about having like a business or a side hustle is it does feel like another full-time job. So another big part of it has been accepting that I need help, which if you're a med student in type A, you're really good at just doing everything yourself. And you also have to be willing to outsource things. So that's been like another part of my learning journey where I've had to learn to hire out, outsource people who are definitely experts at these things instead of me, to help me get organized, to grow, and to teach me things that I don't know. Because I can do really well at telling you about products and formulation and ingredients and skincare, but I might not be the best at marketing. And I've kind of accepted that. And so it's kind of cool to see it flourishing and becoming something. But it all really did start with just like this little idea that I got curious about, and I used some of my free time to research. And kind of going back to the original question about like taking your foot off the gas pedal, this to me was a way to find passion outside of my day-to-day in medicine. And it's exciting to me to do and build and learn from, and just hear about different entrepreneurs, different business people, because a lot of medicine is not like that. And sometimes medicine is very isolating when you're on your own journey. So meeting other people who are entrepreneurs or getting started has also been a cool part of it. So if you're sitting on an idea, or if you're wondering if you should do something, you should, because I promise you, you are very capable of learning it.
Thank you for sharing that.
Yeah. I can just sit here and sip my tea. So you guys let me know. Oh, we have a raised hand. Maha.
Assalamualaikum. I guess I can take my mask off. I'm in my car. I had a quick, thank you so much for doing this chat for us. I'm really excited to hear from you. I actually had a quick question about So I guess just like motherhood and medicine, I feel like something I think about a little bit more now that I'm getting close to 30. Um, and I just wonder if there's like some recommendations that you have about like optimizing your schedule. I've heard that there's never really a good time or like it just happens when it happens and you kind of figure it out. But just talking about like just managing that aspect of, being a person, I guess.
Yeah, absolutely. I had my kids, my first born was, I started intern year 6 weeks pregnant. And my second child, I was in my final year of residency and I was the chief resident. So both of those times didn't feel like great times, but that was our timing. We had been married for 3 years prior to attempting pregnancy. So we really felt like we were ready to become parents. And I didn't want to wait to feel settled to get that done because, I mean, parenthood, motherhood is a journey. It doesn't just end after you give birth. It's actually just beginning. So I realized that number one, there's literally thousands of women, parents, men too, who've done this before you. So if you want to have children, you should. And the other big thing is there's actually a huge village of women physicians who advocate for this stuff. So one of the cool things I learned about after I became pregnant was a Facebook group of over like 100,000 physician moms. It's literally called Physician Moms Group. And it was like my people. Like I joined that group, I read posts, I was like, oh, these women get me, they understand this. I asked my questions, I searched that Facebook group and like read threads about all sorts of things because motherhood is really scary. And I knew that I could be a good doctor, but I was like, I don't know how to be a mom. Like, where's a training manual for this? So you don't get one. You just kind of have to learn it along the way, which is really tough. But you're right, there isn't a great time. The biggest thing though is you have to advocate for yourself, whether you're going to be, a dad in medicine or a mom in medicine. There is opportunity for your program, whatever stage you're at, to make time for you. And that was my biggest thing is not being apologetic about pregnancy. Like we are often shamed for wanting that part of things too, and it shouldn't be that way. So I very confidently went to my program literally a week into residency and said, hi, I am 7 weeks pregnant, so I'm going to need some maternity leave. And we figured out my schedule. We had to rearrange things. I put some electives towards the back end, towards my delivery time, so I wouldn't be missing out on the requirements I needed to graduate and move to the next step. Versus, in my opinion, I don't think you should hide the pregnancy until it's later on because you're going to shoot yourself in the foot because you won't be able to change your schedule necessarily. So it was helpful to me to talk to my program directors and let them know what I needed so that they could anticipate what was next for me. And it made the process a lot easier. When you're interviewing for residencies, just take a look around and notice, is anybody else here? Are any of the residents parents? What do they do with their kids? What's their experience been like? Because in your residency interviews, it's very important to kind of learn about that culture. And there are obviously malignant programs who look down on that. And why would you you'd rather go unmatched than be at a program that's not going to support your family planning. Hopefully that was helpful.
My name is Isra. Thank you so much for answering that question. I feel like everyone here is stealing my questions because I was thinking the exact same thing. I kind of wanted to add to that. When you were kind of looking for a residency program, you mentioned looking around to see if it was like supportive of family planning and things like that. Are there other aspects that you vetted culture-wise? I know it's like different within the last couple of years with residency interviews being virtual and not a lot of opportunity for second look and things like that. But what are the kinds of things that were like in the back of your mind when you were deciding like, this is a place where I could potentially be happy, or this is a place where I don't see myself fitting in?
Yeah, I think one really helpful question that I asked was asking residents, obviously when they're away from faculty, what's one thing you would change about your program? And if there's something really brewing or an issue, it's going to come to light because residents are tired and they're honest. And if you catch them at a good time, you'll get that answer. So it was really important for me to ask that. Obviously, not as my first question, like you kind of want to warm them up and be nice, and then maybe just casually slide that in there. Like, hey, if there was something you could change about your program, what would it be? Because it might be a really big red flag for you. Like if somebody says, oh, my program's really annoying with call and I have to take call X, Y, and Z times, even as a third year, maybe that's going to be a big deal for you. For me, when I was choosing my rank list, it really came down to what were the residents like. And when I chose my program, it was because the residents there were so happy. Everybody was genuinely happy to be there. The program was super friendly. I saw other people there who had kids, and I was like, you know what? This is going to be the next 3 years of my life. Like, it doesn't have to be miserable. And so that to me was really high on my list. Of course, you want good training too. That's a non-negotiable, but you do really want to think about the culture, because that's going to be your day in and day out. And there's only so much you can actually change. So if something is coming off as a red flag to you, it probably is, and maybe it should go lower on your list.
And was location like high up on your list as well?
Yes, it was. I really wanted to be in Michigan and stay here because my family is here, but we did interview outside of Michigan. I say we because my husband was a part of this process. He was like pooping his pants on my match day because I know, like he had said, I will support you wherever we match. But like I saw it in his eyes before I opened my envelope. Like I could see the fear. If we were going to have to leave Michigan, he was going to be really nervous. But we made that decision that this is what we wanted. He's a pharmacist, by the way, so he could relocate. He was in medicine, but he understood the process. But we were really happy to stay in Michigan, and that was a big deal for me. I know for some people it's not an option, and I did get really lucky to match in derm in my home state. But I do think that for me, family support was a really big aspect of family planning. Like having my mom and my mother-in-law around was very helpful to me. And I can't ever discount that they were a huge part of my village in helping me raise my kids.
I had a quick question as well. I think I can just say, like, on behalf of a lot of us here, that you're truly such an inspiration for some of us young and aspiring Muslim doctors. And I was just wondering, we were talking about residency applications, and obviously dermatology is really competitive. I was wondering, what kind of things on your application do you think made you stand out when you were applying?
Yeah, that's a good question. I was high in leadership. I think that was like a big part of my application, the American Medical Women's Association leadership, and that I was a student president nationally, because it gave me a lot of opportunity and exposure. That came up on every single interview of mine. So if you do find an organization like this one that you're really passionate about and you want to slowly move up the ranks or take on some leadership positions, it is good to do that versus dabbling in a lot of small volunteer activities, because it's really hard to talk about like a single experience of like, oh, I checked people in for a blood drive at my school. Like, that's good for you. But like, you got to do a little more than that. So if you find that you're passionate about something in specific, maybe pursue that. It doesn't have to be a student organization though. A lot of my friends who matched into derm just had interesting applications otherwise, like they were doing something outside of medicine that an interview reviewer found interesting. They had maybe some sort of outside passion that was really cool. But I do think my leadership side of things was helpful, because I know it wasn't my school, because a lot of people didn't even know what OUWV was. Lots of people were like, Rochester, like New York. And so it was very confusing and had to explain it over and over. But I do think that part of things helped for me. The other big thing was the art side of things. I was very into talking about art and how that was a big part of my life. I helped Beaumont Troy start an inpatient art rehab program for their inpatient rehab center. So that came up a lot for me. So I really did do things in medical school that were fulfilling to me. And I think that showed on my application. And that can be really hard when you're like a tired med student. You're like, I don't have passions. Like, I just want to match. Like, I don't want to have passions. And so I understand that part can feel a little overwhelming and daunting. But if there is something you gravitate towards naturally, even if it's not very traditional, still pursue it because it will show on your application that you're passionate about it.
Thanks for that. Also, I had a follow-up question. Did your med school have a home derm residency program?
We did not. So that was another reason why they were really nervous about that. A lot of people say like you have to have a home derm program to match. You can absolutely match without one. The biggest things that I think helped me was doing my away rotations because I got to go to those programs. You spend an entire month with these programs as an away rotator. So they really, it's like a month-long interview. They really get to know you, know your personality. I dropped a few times in there, like, I really want to stay in Michigan. I really like it here. So I try to make sure I said those things over and over, obviously not in an annoying way, but I do think it's helpful to have away rotations. And if you have the opportunity to do them, do as many as you can, because that's a way to get your application in front of people. I reviewed applications one year and it was like the most daunting thing because everybody looks the same, right? And especially now with step one being pass fail, it's going to be similar to that, but potentially that's going to help us because for me, I had to apply to every single dermatology residency program because I just didn't know what my luck was going to be. But hopefully by doing this process, it's going to help people narrow down areas, niches, regions, and do away rotations at those places and really allow your personality to come through. And I do think that that ultimately is the goal of making step one pass fail so that people can really shine on their individual attributes instead of a number on one test. Yes, I see a hand raised.
I hope it's okay if I ask another question. So you mentioned that you started your Instagram back when it was simpler before Reels, but still it was during your residency, the first year of derm and second overall, if I remember correctly. And obviously you mentioned that it's very important to you then and now to have a high level of integrity and professionalism, et cetera. Don't waste everything you've worked for. So that's, seems like you did everything in your power to keep that up. However, it seems like, especially, and not that this is a bad thing, but especially with the older generation, social media in general, because of some maybe less savory actors, people kind of have an idea that anyone who's involved in it, it's a bad idea and can only go south. So did you experience any stigma when starting your residency? And also, how did you walk that line? Because although you graduated medical school, you didn't have you weren't fully a dermatologist yet, and I'm sure you didn't want to squander that opportunity. So how did you walk that line of doing what you love, but at the same time remaining professional? Well, you did everything you can, but in their eyes.
No, I agree with you because I do see medical students on social media making claims that they probably shouldn't as a med student. And one of the things that was really important to me while I was in residency and getting opportunities was clarifying that I was a dermatology resident. I was like psychotic about doing that because I didn't want to come across that I was board certified because I wasn't. I hadn't earned that yet. And I didn't want to come across as an expert yet in my field because I hadn't achieved that title. So I would get like magazine requests. And if you look back at some of my old magazine requests and commentaries, I always corrected the editors. If they put dermatologist, I would make them change it to dermatology residency residents, because that was important to me that I maintain that integrity and that I was very clear that I was not a dermatologist yet. And then you best believe when I became a board certified dermatologist, that went everywhere. But that's beside the point, because as a med student, brands or companies or people will take advantage of you as a credible person and want to use your word. So you're right. Programs will find you on social media. And if you're doing questionable things like maybe they shouldn't have taken that paid advertisement, or maybe that looks a little sketch or a little inappropriate, they will hold it against you. I was very forthcoming with my program director when I decided to start my dermatology account and said that this is something I was going to do. I was going to be very clear to make sure all the views were my own and that I expressed that. And I openly talked to him about my posts, the good feedback, the bad feedback, and it really helped shape the account. And for me, again, reminding myself to always include educational content on there too. I think has helped maintain the credibility of my page. And also turning down opportunities, even if the money is enticing, because again, it's just not worth it. And you will see people around you doing that. And it makes you wonder, like, would you really recommend that to your patient? And if you wouldn't, just let it go. But as a med student, you're right, you will be under a much bigger light if you choose to do a social media that's public, and your programs will probably find it. So if you would be embarrassed for a program director to see a post, then you probably shouldn't put it up. Now as an attending, I think I have a little more ability to be like witty or funny or silly that I probably wouldn't have as a resident. And I think it's important to kind of keep that check and balance system. One of the people that I always run things by, if I'm like, oh, should I do it or not, is actually my husband, because he's like blatantly honest, like almost too honest. So it is helpful to like get his feedback on things. And he has told me things like, nope, I think you should edit that or change that, or don't put this or take that down, etc. Because you'll find stories of people who have lost their residency spots, medical students who have been kicked out for revealing HIPAA sensitive information, taking photos of like a bloody trauma room. Inappropriate. So you have to be careful with what you post, and you just have to remind yourself that if my patient, my boss, my program director, my future employer saw this, would I be okay to stand in front of it? But also send me your Instagram if you do one so I can follow it.
All right. Well, it's been about an hour. I know, Dr. Fahs, you're a very busy person, and I know everyone here has some Anki to do before they go to bed. So I want to say just, for everyone here, thank you so much for giving us part of your evening to talk with us and sharing with us invaluable information, personal experiences. As was said many times during today, we all look up to you, and inshallah we'll follow the example you've set for generations to come. So jazakallah khair. Quick plug, Dr. Fahs has also agreed to talk at AMSA's conference taking place this summer in Ann Arbor. So send in your abstracts, present a poster, fly down to Ann Arbor, eat some good halal food due to the multitude of places we have here. And if you have any questions, please feel free to message our Instagram, our Twitter, go on our website, amsa-national.com. And inshallah, if you want to go back to this this talk, we'll be posting it on YouTube in the next day or two. So you could just search AMSA on YouTube and it'll come up, or find it on the website.
Yeah, thank you guys for having me. Happy to answer any questions. If you want to email me, I put my email in the chat box for you. It may take me a few days to get back to you, but I'm happy to help in any way I can. Just remind yourself to pace yourself on this journey. It is a long one, but it is worth it. You are making the right decisions. You will be successful at the end of this. It's all going to work out and be okay. So hopefully this talk was helpful for you guys, and I'm looking forward to doing some more with AMSA, inshallah, in the summer, right? Inshallah.
Inshallah. All right, everyone. Good night.
Have a good night. Take care. Salam.
لا إله إلا الله لا إله إلا الله لا إله إلا الله ما لنا